This program explores integrative approaches intended to support, not replace conventional medical care. The information presented is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult your physician or qualified healthcare provider regarding any medical condition or treatment decisions. Welcome to Integrative Cancer Solutions with Dr. Karlfeldt. A cancer diagnosis can feel overwhelming. You're suddenly faced with urgent decisions, complex information, and a path that may not feel fully clear. This show is here to help you navigate that journey with knowledge, perspective, and confidence. Each episode brings you real stories, expert insights, and integrative approaches designed to support your body alongside conventional treatment, expanding your options and strengthening your foundation for healing. And now, let's begin. Well, I have the absolute pleasure of having Dr. Jennifer Rond with me today. Dr. Rond, this is going to be an amazing story, and you've had quite a journey.
Thank you. It's an honor to be here. I've actually listened to your podcast long before you contacted me, and I've taken pieces of, information from that in my own care and in my own life. You've been an inspiration to me too.
Oh, well, thank you, and that's a reason I want to pick people's brains and see what they've done that's been successful, and then so other people can learn, because we want to shorten that learning curve, especially with cancer.
Absolutely.
So you've been an ER doc for almost like a quarter of a century, and
That sounds so long.
you're way too young for that, right?
Oh, yeah, right, exactly.
So tell me a little bit about the life of an ER doc. What does that look like? Hours, sleep, eating. What does that look like?
Yes, thank you for bringing that to light. First I want to say, when I was in medical school, I was looking for a specialty that really felt like I could use my heart and my soul and my mind together. And believe it or not, in the conventional field, it was emergency medicine. I fell in love with it, just like you fall in love with a person. So, it was really a connection. And so what happens is, slowly, as I'm sure you're aware sometimes too, like when you're in medical school, your time, is very valuable. You don't realize it. And it gets sort of taken away from you. You're studying and you're heading toward this goal. And, you have to keep this goal in mind of being, that healer and provider, that doctor that you really want to be. So as you do it, little things slip in. Like, for instance, with emergency medicine, shift work. And you think to yourself, well, gosh, I have colleagues who are taking call. They have to be up all night. Like, they don't get to choose that. And at least I get to choose when I'm up all night, and I can, hopefully, like, have some time during the week where I can go shopping and no one else is shopping. And so I thought shift work sounded kind of cool, Of course, now I understand how important our circadian rhythm is and how that works 100% against our circadian rhythm. And even when I tried in my career to ask my colleagues, please, and my advisors, and I said, can I please do like all the nights together? And then maybe we could work slowly through the days and slowly progress so that I could honor my circadian rhythm. It just wasn't an option. It would have imposed too much on my colleagues. I certainly didn't want to do that. So sleep was never really anything great for me for 25 years, or a quarter century, as you put it. Sounds a long time.
It sounds so long, doesn't it?
It does. And then every day, you walk into uncertainty. I think that has its pluses and minuses. You feel very powerful, like you're ready for anything that walks through that door. And then there's the vulnerable side, the stress and all that you sort of just push down inside, and you put on a facade of, I got this, whether you want to or not. And every day that you do that, every night that you do that, you are not honoring your stress unless you do, a stress mediation practice, which is something, of course, that I do now, And then eating wise, you could be hungry, you could be hangry, you got to keep on going. You just got to keep on going. You can't honor your own bodily functions. Everything slowly gets sort of taken away from you. What I didn't realize is I did have some, I could have taken some of that back while I was working, However, I didn't. I gave all that up willingly for the career that I had. And I did love practicing emergency medicine. I still feel like an emergency physician at heart. I know when I get on an airplane, I'm the one that's going to take care of the person if they ever have a problem. I'm there, I got you, that kind of thing. That's, the wonderful thing about being an emergency physician.
Yeah, and that, I mean, the ability to give to that level is phenomenal. As you're saying, I mean, you're kind of losing yourself and then the care for yourself while you're then, you know, resolving critical situations for other people.
Right. And it was really okay. I felt like I kept it in check until, our healthcare system changed. And I really felt like, that we were just, a body that was put into the position to do this job. And that if I were to leave after, all these years I put in and all the connections I've made and, all the great work I've done, that they would really miss me. But the truth is, the second that I left the emergency department, even before that, I was replaced by someone making the exact same amount of money, getting the same benefits as me, even though they just are straight out of residency. And that's fine. That's how the system works. But, it's something to know.
Yeah, yeah, you feel so unique and you feel you're contributing and you are. I mean, it's amazing things you're doing, but like you're saying, when you step out and there's another person just stepping in, so you're sacrificing yourself thinking that, I'm the one they're really needing and wanting, and in reality, uh, it isn't. I mean, even though what you're doing is amazing.
And I just wanted to feel, I guess, appreciated. That's all.
Yeah.
Not that I was the one or anything, but, I had years of experience and, I was able to teach residents, students, which is truly a passion of mine, was teaching. And so those things were really, I love those parts of my job. And I acknowledge the parts that were taken from me as well. And I had to, because one day, I was looking at my phone after getting a lymph node removed, and it was cancer, and it just was shocking and disruptive and, shook my world and shook me to the core because truthfully, I felt great. Physically, I felt great. I, was in really good shape. I thought, I had it all. I was a great mother, I thought, and a great, physician, and I was able to do it all, and I felt very powerful. And then, and I felt my body was very powerful. And, when that moment where you lose control, happens, it's really humbling, and it's necessary sometimes.
And so tell me a little bit about that. I mean, here you are, you're an ER doc, you're used to functioning on this, high level performance. And tell me a little bit about kind of signs, symptoms that made you wonder what was going on.
So what had happened was, I actually was just playing like a fun game with my nephew, and I tore my hamstring, and that was the first time I had to have surgery. So I was out of the ER for 6 weeks, and that was when I realized, oh my gosh, I have a break from this. How great is this? Even though I was recovering from surgery. And it was the same time that I had felt a lymph node kind of in my groin. And I thought, well, maybe I better, it's been there for a while, every day I felt it was still there. You had better get it checked out and just see what's going on. I never had any other warning signs whatsoever. I have, I felt extremely healthy, the way that you would feel healthy and vibrant. And, I was so fortunate that I was able to have one of my colleagues take out the lymph node. And then I wasn't so bright. When I looked up my results, I was by myself. And that's when, everything came crashing in. So I didn't have any warning signs or symptoms. However, I did feel, in my last few years of my career, that I was not honoring my own health as much as I should have, that I was not dealing with stress the way I should have. Like there was a little voice in the back, but I didn't really listen to it
So
until
here
the journey
so,
began.
yeah, so they removed the lymph node and then biopsied and the you got the result and it was cancer. Yeah. So how did that I mean, you're looking at your phone, cancer. What was going through your head at that time?
Well, I couldn't, first of all, believe that it was me, and I felt like my entire world was crumbling. And I thought immediately of my son. He's in high school, and I wanted to be around for him. Was I going to make it? Was I going to be alive for him to see him graduate high school? To see him, you know, move on from high school and find out who he is as a person and, one day get married. Am I going to be there for those landmarks? Those kinds of things went through my head. And also, I had a partner that I was, in love with, and I really wanted to find out where that was going. And, I was like, well, life seems to just be like just starting right now. Maybe I want to, why is this being taken away from me? And so it was devastating. It was devastating. And I'll never forget that moment when I saw the results, what I felt like.
And so, what were you diagnosed with? I mean, did you know at that point what type of cancer? Was there further testing that you were doing?
Yeah, interestingly enough, so when my lymph node was removed and I was waiting for my biopsy results, it just took an incredibly long time. I was like, what's going on? Is it something weird like cat scratch disease? What could it be? I don't have a cat. But the length of time happened because they were trying to figure out what it was. It is a neuroendocrine tumor. And the very first thing that every cancer patient does, and if you don't do it, I would be shocked. Like, you would not be a normal human if you didn't go on the internet and look and see, what does this mean? What does this mean for me? Am I going to be around in a year, 2 years? What kind of treatments do I have to have? Do I need chemotherapy? Like, what's going to happen to my body? What's going to happen to my life? Am I going to be able to be who I am anymore? Those are all the things that, just are swirling around in your head. And it's a 24/7, 24/7 while you're sleeping, especially, or trying to sleep, I should say. So it was extremely, extremely anxiety ridden. It was filled with fear. I felt like a victim. All those things, which are really, really hard to do, but they are part of the journey. They are part of the journey.
Yeah, yeah. Yeah, I can't even imagine. And that's, and we're going to talk a little bit later on about a project that I know that you want to start, and for people in this kind of scenario. So when did you find out? I mean, you said neuroendocrine, but there are plenty of different neuroendocrine. I mean, when did you find out the type of neuroendocrine that it is? And also explain a little bit what neuroendocrine means for the audience.
Yeah, it's a very difficult thing to explain because it is different in every single person. And at the time when I was diagnosed with it, it wasn't very well known exactly 100% what it is. I mean, Steve Jobs had a neuroendocrine tumor which involved his pancreas. So that became famous, and that type of neuroendocrine tumor. There are gastric neuroendocrine tumors. They're all over the place, and they can be associated with, the release of hormones, which make you very nervous and cause a lot of other like medical issues. Mine, however, was an unusual one, and I was grateful that I got to where I work. There was a neuroendocrine tumor specialist. That's where I started. And then I ended up going to University of Chicago, where they have a neuroendocrine tumor clinic. And I see an oncologist and surgeon who work together, who are experts in the field and have been studying this. This is their passion. And they basically told me mine was located under my tailbone. And I was incredibly fortunate. It was removed by an amazing surgeon. I had involvement of my lymph nodes, which I still have. And I had, at that time, 4 small foci in my liver as well, because our endocrine tumor likes to go to the liver. And so that's where I started. And it was scary. And I had to go through the PET scans and the MRIs and all the fear and the scanxiety and all the things that, go with having a cancer diagnosis. But when you have a neuroendocrine tumor, it's not like having any other type of cancer. It's not very well known and studied. Some are, Mine was, they didn't know what to do with mine because mine was an unusual form, and no one else actually at the time has the same one. So it's hard to predict what would happen. And so, I'm left still with someone's, I was left with the uncertainty, like, where do I go from here? Yet I was given like amazing conventional treatment. And that's when I started thinking to myself, well, you know what? I'll go looking for the answers. I am going to take care of this body that was given to me in this life, and I'm going to do it the best I can. And that's how I started, my whole journey down integrative medicine, naturopathic oncology, and all of that.
And so here you removed that, you got diagnosed. It was a very a unique type of neuroendocrine tumor. So in regards to then the traditional oncology care, you had the surgery, and what else transpired in that field? I mean, did they say that we did the surgery, I'm going to do chemo, and then you're going to be clear forever? Or what was the conversation?
So mine is grade 2, which is a slower growing. And I was incredibly grateful for that. So they weren't sure, like, they're like, we're going to kind of have to see what happens, we can't say, exactly 100% what you're going to need, but there is an injection I could get called somatostatin. And it's something that is given to neuroendocrine patients when you have enough tumor burden. And so that was always a thought, like, do I have to go down that pathway? Then I have to have my gallbladder removed. And I'm just not a big fan of having your body opened and things removed, when it was, if it's not necessary. And certainly the gallbladder has a whole bunch of vital functions. And, I love, my digestive system, and I like to keep it whole. So I really, in my mind, I was like, what can I do so that I don't have to end up going down that pathway? I really would like to find ways that I can create healing in my body, the same body, excuse me, that produced this, cancer is the same body that can help, slowly maybe say goodbye to the cancer. Yeah.
I love that. And I mean, here you are, you're a medical doctor, and you lived in the medical space. This is what you do, this is what you've done. I mean, what made you even start thinking about other type of therapies? Why weren't you just still kind of in that model, and that here is where the solutions are, everything is not tested, it's not, what made you shift? I mean, yes, I know that you were diagnosed, but you still would have, there are plenty of people have been diagnosed and not had that shift.
Yeah. And I'll tell you what made me shift. It wasn't anything in the medical field. It was an opportunity to have friends and a support group. And two friends of mine, especially one friend named Gina, she is just such an insightful human being. And she was doing some of these other things. She's like, I'm taking these supplements. I have this integrative oncologist that I see. And I was like, well, what is that? And she said to me, oh my gosh, this is what integrative medicine is. Here she is, and she is a very smart human being. She's not in the medical field, and she knew all of this about integrative medicine. I didn't even know it existed. 25 years as a physician, and I didn't know about it. So, I immediately just started like a sponge, like you are when you're a child, curious and looking into it and trying to figure it out. And at the same time, my employer where I worked at Northwestern had a faculty fellowship in integrative medicine. And it just sort of arrived. I just felt like, oh my gosh, if you just slow down and listen and you have connections that are really valuable, a window or a door opens and says, this is your next step, So I kind of felt like I was invited into this, integrative medicine fellowships, which I ate it up. I loved it. I loved every minute of it. And I learned so much. And I could not believe, oh my gosh, we all work together. All these tools that I could use that I was already using. And then I decided to see an integrative physician myself and a naturopathic oncologist. So the input from those two, plus the studying, plus, the curiosity, has created like this new like thirst for knowledge inside of me. And it was the same feeling I had when I decided I wanted to help people. You know, it's the same exact like I want to continue to be a healer, but I need to do it in a different way. And, you know, the emergency department was not that type of lifestyle. Emergency medicine was not for me anymore. You know, as much as I loved it, I needed to look to something else, something that would be good for my health, something that would nourish me and not remove my health. And so that it was a slow process. And as I always tell everybody, you know, it was one step at a time that got me to where I am now. And I hope I have a whole bunch of more steps to do too.
It's all, I mean, we're always learning, and that's why I love also doing these things, is because I'm learning all the time. Yeah, I get to talk to amazing people, brilliant people, and we always learn. I'm curious. So here, I mean, you're coming from the medical model, and here you have this other model. So tell me a little bit. I mean, what were some of the kind of stark differences that you recognize, you know, between the two models?
Yeah. So, like, one thing, like when we were doing our fellowship, the first thing we did before we started learning was to do a meditation together. And it just brought us into the moment, and it made us mindful and made our minds open. And then we were ready to learn. So it's a whole different way than, you know, conventional medicine. And what I have learned, you know, like emergency medicine and acute care medicine, that works. You know, we are able to really take care of acute problems really well in this country. Yet over my 25 years in the emergency department, I also saw patients coming in, you know, monthly or every 2 months with the same issue, abdominal pain or chest pain or, you know, over and over and over again. And there were no answers for them. And we didn't have time for them in the ER. It was terrible. You know, I really would love to sit down with them and say, hey, you know, I really think stress is playing a role. And let's get you like into a therapist, or let's have you start using these breathing techniques or whatever it was. But there was never any time to do that. And it was rather shunned also. You know, I had so many things going on in the ER. So recognizing that conventional medicine is great for certain things and sort of leaves out a huge subset of our population. And if you think that you are just going to gracefully grow old, which I really hope everybody does, but you will develop a chronic disease. You will develop something that needs you to look inside and get different kind of healing. And that's where integrative medicine comes in, as well as, you know, saying, hey, you know, we all need to be on the edge of prevention. Like how are we going to prevent these things from happening? Well, you're going to prevent things from happening by doing this 4-7-8 breathing twice a day. You know, you're going to prevent it by completely changing how you think about your nutrition and where you start and what kinds of things you're going to put into your body that are going to heal you. You know, you are going to start by honoring your circadian rhythm, by waking up and getting some beautiful sunlight like I am right now in the window here, and that you are, I see, you know, and, you know, honoring the beginning of a new day, and, you know, honoring when you're going to sleep and letting your body rest and your immune system take over and maybe get rid of some of those cancer cells or get rid of what you don't need. So, you know, integrative medicine is really great. It's about slowing down. It's about using all the tools. And as I went on this path of learning all these different tools and different kinds of practitioners that are out there, I had always in my heart had a special spot for Dr. Nasha Winters, because I read her book, you know, when I was diagnosed with cancer, and it just made so much sense to me. Like, why are we always thinking like cancer is bad luck? Cancer's not bad luck. Cancer is all these epigenetic things that are happening around us during our life, and we have so much control over it, but we have to get in early, you know? And after, you know, all this conventional treatment, you know, you put so much investment in your body, you put toxins in your body, you radiate yourself, you do all these things which are necessary to get rid of, you know, the tumor and the disease. Then you need to, like, what are you going to do after that, you know? And you need to, like, then, you know, heal your body. How are you going to do that? And so the naturopathic way, I love that, you know, the way of healing the body through naturopathic oncology. And I actually am in her course right now. about to take my final exam. So
I
wish me
love,
luck.
yeah, yeah. No, it's a great course. Yeah, I've done it myself. Dr. Nasha is a dear friend. I mean, what she impact she's having in the integrative oncology space, yeah, is phenomenal. So I'm really, yeah, you're in good hands.
Yeah. And one other thing I wanted to mention is that, naturopathic medicine has been around far longer than integrative and functional medicine. And, it's hard for me to not embrace it and to want all of my, conventional colleagues to sort of take a look at it and embrace it as well and understand that we need to provide whatever healing is out there that the world offers, from 5,000 years ago to present, to help our patients heal, maybe not in the emergency department, but, in order to do that too, we need to spend time. We need to figure out what are people about? What is this human being about that has cancer, and that takes time.
Yeah, yeah. So tell me a little bit about your journey then. So here you are, yeah, you're opting not to do more surgery. You love your gallbladder and you want to keep it, yeah, because God gave it to us for a reason, and it functions very well in the body. So what else? What was your next step? I mean, you're learning about this integrative, and yet you're having cancer inside. I mean, how are you addressing this?
Yeah. So actually, my as I went along, I'm in what's called active surveillance. So I get a PET scan now once a year. So initially it was every 3 months, then 6 months, and then at 9 months, and then now a year. So the reason why that happened, and I didn't have to go down the somatostatin gallbladder out, get out of here pathway, was because I started all these using these tools. I changed my lifestyle from start, as much as I could as a human being. I changed my job. I changed my nutrition. I'm still on, trying to be even more vigilant in a very, as I can with my nutrition. And my stress mediation, I honor that every day, my circadian rhythm. So all those things I did, and there were quite a few. And, I was on mistletoe and low dose naltrexone for a while. I supplement also. And so with all of the things I was doing, I would go for my appointments to my, oncologists, and they would say, you're boring. We have nothing else to offer you right now because you're doing well. And those 4 initial foci in my liver are now down to 1. And I don't know if it's just because of better visualization from the PET scan. I don't think so. I think it's, partly that I am slowly, hopefully, clearing out the cells. And the one thing that I've learned on this journey too is that, we don't have to say and worry every single day, am I cancer free? Am I cancer free? It's more important that you're driving the car and the cancer is in the back seat or elsewhere and is not driving the car. And that's somewhere where like Dr. Nasha and I like really agree on that. Like, are we really getting rid of the stem cells that were there even in the beginning? Is that what we should think about every single day? Or should we think about this day that we have? And what are we going to do today to like support our health and to live our lives and, live a meaningful life? So I kind of got away from what you were asking. You were saying, how are you not going down this gallbladder pathway? Well, so they never really found much more. And I'm under active surveillance. And I do believe all the interventions I've done have have healed my body. And I feel like I'm healing my body every day. Do I take steps backward? Yes, I do. When I was starting my new practice where, integrative cancer care, a lot comes with that, a lot of stress. And so, I upped my stress practice. I started journaling again, like aggressively and meditating and working out and do all the things. And yet still you take a couple steps backward and you honor that. And you say, yes, I'm taking a couple steps backward so that eventually I can take so many more forward.
Yeah, I love, and I loved, talking about, being the one driving the car versus cancer, and that is usually, it's a mind shift that's so important because, like you're talking about, that scan anxiety, lab anxiety, when you're in that spot, you're essentially allowing cancer to guide your life. It's impacting your life, and it's so hard to get away from that. I mean, it's so because it's you feel it's a life and death scenario because you're dealing with cancer, and so how to be able to focus on life versus focus on the possibility of death. And obviously, like you're saying, we were given this day. We got sunshine outside, children, we have grandchildren maybe. We have all of these things, and that is what God gave us today. And so to be able to allow that be the front seat versus the cancer.
Yeah, exactly. I could not agree more. And the first question I ask, of my patients is, what's bringing you joy today? And what is the most important thing in your life today? And in our first consultation, we talk about their family, and, I try to find to them, what motivates them, what brings them purpose, what is their sense of purpose? And instead of focusing on, cancer, because yes, I am a patient with cancer. I'm a human being with cancer. I'm also a mother, a daughter, a sister, a dog owner, a backyard chicken keeper. I'm an artist, I'm a wife, I'm all these things. And I'm not, the cancer is just one of those things.
Yeah.
So,
And so when you work with patients, what are you seeing? How are you seeing what you're doing impacting them? I mean, what are some of the you're bringing all of this to them, and how's that changing them in regards to cancer, life, health, how they feel?
yeah. So I think the number one thing is the same thing that happened to me. I'm empowering them. I'm putting them in charge of their health. I'm saying together, we're working together as partners. I'm listening to them, and we're going through all the different, like we start with, actually I do use Nasha Winter's, her Terrain 10 survey to try to figure out what are the top 3 things that we should start with. But I always start with the pillars of lifestyle. We start there. And some of my patients already are doing a lot of those things, and I love that. Then we can move to the next step and continue to make it so that they are in charge of their health. I want to work with them and figure out what works for them. I have, for example, a patient who grew up on a farm, and she's like, we ate steak and meat every day. And that's what I do. She's like, I will not eat fish, And so it's, you have to honor who they are too as a human being, and what makes them feel like who they are. And that is what makes this patient feel who she is. And so we work, I work within their parameters, and I say, well, what do you think you could do? Could you do this? And so we work together in changing some of those ideas. And then, like as we move down in the consultations, we add other things, we add other adjuncts that would be helpful to them. But the most important thing, number one, is that they are in charge. And I did have a patient come back for a second consultation recently, and I said, what brings you the most joy today? And she said, knowing that I'm in charge of me. I'm in charge of my health. I said, yeah, you are.
You're right. You are. I love
We
it.
all, we have to understand there are so many factors we are in charge of. Of course, there are many things we can't change. If you're living in a zip code where you're near a lot of pollution or electrical wires or whatever it is, so be it. Cross that off your list unless you're going to move. So let's move to the next thing. There's so many other things you can change about, your life if you want to. And every step in the direction, actually, for me, like I feel when I wake up in the morning, when I was in my like maybe late 30s, early 40s, I would have little body aches here and there. And I was, I'm just getting a little old. Well, you know what? Those actually improve when you change what you eat and how you move and how you deal with stress and all that.
And so how can people find out about you? And then later on, I want to talk a little bit about the project the vision that you have in regards to physicians, that have battled cancer in some fashion.
Yes. Okay. So patients can find me on my website, which is medlogicmd.com. I have right now a complimentary 15-minute phone call. I'm happy to speak to anybody for 15 minutes. It's their 15 minutes, whatever they want to talk about. If they want to see if I'm, a good person to partner with for their cancer care, great. If they want to ask me a question about mistletoe, great. Whatever they want to talk about. So there's that. And then I also have complimentary lunch seminars where I do the pillars of health, lifestyle and medicine. And I do those Wednesdays at noon, and that's on the website too, that people can just join in. Anybody can join in. And I like having the more the merrier, because I love the questions at the end. And then, I'm sorry, I forgot what your third.
Well, then I know that you are working on, your vision is to have a group of physicians that understand cancer because they've gone through the journey themselves.
Yes. So, what I would ideally love to do is to make whole person cancer care the standard of care, so that when a patient walks in or when a patient discovers they have cancer, and they go to their oncologist for the first meeting or their primary care doctor on the phone or whoever they speak to, I would love for them to have the option to understand that there's more out there than the conventional care, which I respect so much and I work with. And actually, I will not take any patients that will use me as just alternative care. I definitely honor conventional care. I'm a conventional physician. I'm an MD. However, I want to get the word out there. I want patients to understand from the very beginning that this is available. And that's all I want, and it's not happening. So that would be, anyway, I rack my brain every day. How can I get the message out there? It doesn't have to be me. I would just like them to have a partner in their care, in their journey, that understands that healing requires more than just, treating just the disease. And I want to mention too that there are several oncologists out there who understand this already. So that's great. I love that. And I have a colleague in my course, and we talk about this all the time. She's, an oncologist. So but I myself am trying to find ways to, how do I get the message out there? How do I make whole person care available to everybody? And I don't mean just in the United States, but we seem to have a pretty big problem here with that. Seems to be embraced more fully in other countries. So anyway, this was one of the ways. So I thought to myself, well, gosh, why am I constantly like a mouthpiece for this? Well, there must be other doctors who have cancer who must feel the same way and want to get the message out. So why don't we join forces and make get an SIO, one of those special interest groups going on, Society of Integrative Oncology, and let's create that voice. Let's make it happen. So I am trying to find physicians that are interested, or even providers, or anybody in the medical field, naturopathic, functional, integrative, and conventional. Anybody who's interested, so we could join forces. And another thing I do in all of the talks I give, and I give quite a few talks, at the end I say, your call to action as a patient is to walk into your oncologist's office and say, how do I find this whole person cancer care? What do I do after you've treated me or while you're treating me? What are things I can do to make my body heal? And I'm not asking them to have the answers. I'm just asking them to say, hey, I know here's someone who can help you, or, here's a way to start. I just want that out there.
Yeah, and the thing is that the more you ask and the more you talk about it to your oncologist, then they are going to recognize that this is a need. This is what people are looking for. You may get shut down. They may say, well, that hasn't been studied. No, cutting out sugar doesn't have anything to do with your cancer. Cancer feeds on sugar. It's a fallacy. It hasn't been studied. I mean, all these things that they throw out at you, or saying that, well, let's not bring in anything else, because it can interfere with the therapies that we're doing. Can you just wait until we're done? And so all of these are such common responses that oncologist has. So you just as a patient needs to know that what you're stepping into, that yes, this is probably what they're going to say, but each time you're making this comment, each time you're going to make that oncologist aware that they have, and they're going to have to look at a little bit more, beyond just their, pat answers.
And I really think it's because they have limited time. They're in a system where they have to know so much about, like, that what's changing, all the different new therapies, immunotherapies, targeted therapies, AI. They have to really kind of stay cutting edge, and they have exactly 10 to 15 minutes, maybe 20 with their patient. So I wouldn't actually expect them to have, to be able to bring up these conversations.
No.
I just would love for them to include this option for patients to heal, and see me, see all of us as part of the team. That's all I want. And I want to be part of the team. I want to say to them, listen, you're right. I'm not going to give any supplements that would interfere with your chemotherapy. However, here are some things I do recommend to my patients that make their chemotherapy more, make it stronger and make it more likely that it will kill cancer cells and make their bodies stronger, their immune system, their metabolic health. Let's get them in their best possible state of health when they are receiving these treatments, so they can receive all of your treatment. Let's work together so your patients, have a better quality of life. And they come in like, yes, please give me this, treatment. And I want to get it so that my can kill my cancer cells. And I know, like, my cancer cells are in their most vulnerable state because I'm doing a fast mimicking diet, or, if I decide to add high dose vitamin C, it's a pro-oxidant, just like their chemotherapy. It's not an antioxidant. So things like that, I would just like to, and I'm available. I always tell them, I've met with many where I used to work at the hospital and said, you can call me. Here's my cell phone number. However you want to get in touch with me, I'm available to you all the time.
I love that. Well, Dr. Jennifer Rahn, this has been amazing, and thank you for the wonderful work you're doing. And education is so vital, and I'm so happy that you're doing that and bringing this out, into the community so that they know they have options, they have choices, and bringing the best of both worlds. You want to bring whatever it is that patient need at that moment, whatever combination that is. And so thank you so much for being that spokesperson and, that doctor.
Well, that is very kind of you to say that. I am also self-motivated as a cancer patient to be on the cutting edge of things and to help others like me. So it's very much a lot of self-motivation there. Yeah, but thank you for the very kind words. You also, with your podcast, have brought healing to me and hope. And those things are incredibly important to cancer patients, no matter what stage, whether it's at the beginning or even, 3 years after they've completed treatment. I want to let them know that there is a way that they can make themselves healthier and their bodies heal, so they don't have to have the cancer constantly on their, over their shoulder looking and wondering, is it going to come back?
Yeah, I agree. Well, thank you so much, Jennifer. It's been an absolute pleasure.
Thank you for including me in your podcast. It's been an honor for me. Thank you.
Thank you for spending this time with me today. I know how much courage it takes to seek information and explore your options after a cancer diagnosis. The information shared in this podcast is for educational purposes only and is not intended to diagnose or replace medical care. My goal is to help you make informed decisions and feel empowered as you move forward. If you're looking for personalized guidance and want to explore an integrative approach alongside your current treatment plan, my team and I at the Karlfeldt Center would be honored to support you. You can learn more and schedule a consultation at thekarlfeldtcenter.com. And if this episode brought you value, I encourage you to follow the show so you don't miss future conversations. Thank you for being here. I'll see you next time.